about distributed leadership. So really, the thing we continue to think on is, one of our key pillars is distributed leadership. And so how do we learn from national speakers to grow from that? And then really, how do we start looking at our internal framework and how we're structured as a board and how we're structured as a community to really start looking at how we apply some of those learnings that we've been learning over the last couple of months to ourselves and to our community as a whole in regards to distributed leadership and distributed governance. And so today we're kind of moving into that realm a little bit to talk a little bit more, not necessarily just about the national speakers, but also about us as an organization. And so I'm going to turn it over to Monty to get us kicked off.
Hey, well, hello everyone. I'm Monty Roulier with Community Initiatives, and we've had a chance to share space a couple times with my Elizabeth Hardig, my colleague. John, I wasn't sure if we wanted to use any of those other slides, making sure I was following.
Yeah, I can share them on my screen. How about that?
Great. And so I think there was kind of building on your context, John. I don't know if you wanted to. You and Carolina talk a little bit more about that, and I'm happy to jump on as you talk about board sins and then the thriving.
That sounds good.
You mean just the recap of the meeting? Sorry.
Let's see here. I thought there were, apologies if I'm confused. I thought there were a few slides that you were doing before we jumped into thriving together around kind of the board journey.
Oh yeah. So just a few quick things. You guys can see the slides on the screen, correct? I'll just take that as a yes. So like I said, for the last two board meetings, we've had really national speakers and come and speak. So you can see, reflections. We had our speakers from Archie come and join us, the Central Oregon Health Council, Common Ground Health, and Trenton Health Team. And again, I would call out that we all remember Wade from Common Ground coming, and he was a very inspirational speaker, especially in the work that they're doing under Common Ground. And Caroline, we can see your notes up, just as an FYI.
Thank you, appreciate that. So you should be seeing reflections, a reflection screen.
Yep.
Okay, thank you.
There we go. So just a few kind of key reflections that came to my mind in these speakers, and Caroline, maybe you can jump in as well and share some of the key reflections you saw. But a lot of what they were talking about was, a few things: gathering authentic community voice. And that's really, I listened back to the December meeting, which is sometimes hard to remember. And I remember the comment came up to talk about active versus passive engagement. So when we're really looking at community voice and engaging our community as a whole, how are we really gathering that? And are we really being active in that voice where the community members feel like they're really contributing to that work? Or are we being passive? I think in my mind, a key example that I could think in regards to our governance is that we've always had a consumer seat on the board, but we've never really seen that seat come to fruition or really bring that full what we could do with consumer input to our organization. So to me, in ways, that is kind of a passive way of checking the box to get the work done, whereas we need to dig a little bit deeper to see how we can continue to provide an active voice to it. It was good intentions, but again, we just learn from it and adjust. Another thing I think Wade brought up a lot that resonated a lot with myself is just the notion that, we are supporting the work. We're not the doers of the work. So we support the collaboration and bring partners together for a shared mission, a shared vision, a shared direction. But then we're really relying on the community to go out and do the great work that we're helping support and helping align the mission around. And so, a lot of times when we've looked at the Medicaid transformation project, sometimes we've crossed that line a lot between on the convener and the doer. And so as we're focusing on our future state, really looking at how we can stay in our lane as really the catalyst for this work was always the direct doer of the work, and only be in that position if need arises in it as a last resort. Caroline or Monte, though, is there any other key themes that you feel like came out of those talks that you think we should kind of keep in our head as well as we're going through today?
I think something from January, we all went out into breakouts, and it sounds like a theme for everyone was just this recognition that we would really have to focus on relationship building in a way that we didn't do under the Medicaid transformation. I mean, we built relationships, but I think we're going to have to take it to a whole other level. And it's kind of like if trust and relationships are going to be our currency to achieve great things for our region, then we need to build up those reserves this year. And so a lot of that work, or even asking you to join partner convenings, is about also getting you to be in the same space with some of our funded partners and learn about their work and listen to it and think about like what it means for as a board member, your role as a board member, like what should you take back to the board and how should that shape policies. So there is a sense that relationship building is going to be front and center this year. And I don't know, I think when we were talking with Monty and Elizabeth about today's session, I think we recognize that many of you are probably wondering where is this heading now that we've heard from national speakers. I think some of you are excited. I think for some of you, it might still feel vague. To be honest, some days I feel like, oh man, this is still vague. And then some days I feel like, oh, I think I know what direction we're going. But this is a chance today to kind of voice any of those concerns or feelings that you have. Like, are you confused? Do you know where we're headed? And today we're going to try to provide a little bit of that direction, right, John? Like what to expect in this bridge year. John, do you want me to move to the next slide about the strategy work group, or did you want to see if the board had any other thoughts or comments?
Well, do board members have any things that they feel like resonated with themselves over the last two meetings that they'd like to comment on? And you can either type it in the chat or you can unmute and share right now. Well, I'll encourage you guys as we're going through today, if there's things that resonate, please feel free to keep dumping them in the chat throughout this conversation or this presentation. It's always great to capture it, whether it's right now, whether it's 10 minutes from now, or even if things come up over the course in between meetings, you need to share information. And Caroline, if you want to go to the next slide. So really what we've been doing as an organization has been evolving from almost like a top-down transformation project governance model to being a little bit more broader. You can see that really occurred over the last few board meetings where we've encouraged the Coalition for Health Improvement leadership members to start joining the conversation, and especially during the board learning sessions, incorporating them into the discussion so that it wasn't just a listen to what the board says, but really how are you helping influence and providing feedback into the discussions we're having at the governing board level. Same thing with community members as well. I know there's a few community members that have been on this call that have actively shared some input at the previous governing board meetings. We are really looking again to expand that principle and that idea to the work that we are doing with the strategy work group. And I know Molly shared a little bit of this at one of our previous meetings, but our strategy work group is really expanding to be an board-only work group to really include the Coalition for Health Improvement leaders, as well as some of our community member leaders as well. And so we are actually in the process right now of recruiting new members, both a few at board level and as well as in the community level, to bring them into the work group. And so the work group focus is also going to shift a little bit now that we've designed the 3 pillars to really, you can see those top 3 bullets on the screen. Champion NCACH, our mission, our guiding principles, and the 3 pillars, and champion that across the community. Right, we spent as a board and as an organization a year and a half really getting ourselves centered and focused on this. But now we need to do the job of bringing this out to the community, as well as gathering the community's feedback to learn how we can adjust and grow as an organization. This is, again, something that we want to tell North Central Washington, this is what we're doing. You can come aboard or not, but really, tell them where we've come in our journey and have them join us in that journey and help shape this work moving forward. And so again, that includes connecting across differences, organizations, and roles, knowing that as we look at how we build out and bring the 3 pillars to life, there's going to potentially be some tough conversations in there. I think the key example for me is that we have a pullover shared data measurement. And what we do know is that NCACH is not, the end all be all for data, but we have a lot of key partners in there, including public health, including hospitals, and including other community organizations, that we have to work together to figure out what this anchoring and shared data measurement means, and how do we do it as a community, and who's on first for doing that work. And so really looking at the differences of those roles and the different organizations and coming into agreement. And then really center the community needs through new ways of learning and working together. So what we are promoting may sound simple, but in a lot of ways, it can be pretty radical. And so we need to bring the community along and understanding what that work does and growing it. So really, our ultimate goal is by the end of the year, we develop an accessible, sustainable, community tested version of our 3 pillars. So we're not expecting to have a plan and a distributed model in April or in June, but really at the end of the year, we'd like to see really something that's more plan oriented or based, that we can really say, this is what we're going to do driving forward into the future. If you go to the next slide, this gives you a little bit of a version of how to do it. And, a lot of the ways that, I'll say I myself have been looking at this, and I think has been discussed in the strategy work group. It's almost like a 3-step approach, right? First, we really need to focus on building for an inclusive process of distributed leadership. We can't develop a portfolio until we have the players together in a process that makes shared decision making. And in a way, we can't really anchor ourselves in shared measurement until we have those individuals and those players at the table as well. And so, again, it's really championing those priorities, bringing the people together, and understanding how we make shared decisions and how we focus the work together in distributed fashion as a community. And then we focus on how we do that by anchoring in shared measurement. So again, working with our key partners that we bring to the table to figure out how we measure our work, how we measure our priorities and identify those gaps. And this includes both qualitative and quantitative data, which I'll be the first to say, I always get those 2 mixed up. So I'm not saying, again, I am a data expert, but really how we gather both, that hard data, the anecdotal data, and the stories about how the work is being achieved. And that really needs to be done through multiple partners. Not one of us can own that. And then really bringing the data and the distributed decision-making process together to advance and develop a regional community tested portfolio that we can utilize to drive change in our region. And again, this is really getting to that step is something that we're looking at doing over the course of the year versus something that we are saying that we're going to be achieving in the next month or 2. I think Monte had one of the initial slides when we had all the different speakers up there, right, to move at the speed of trust. And so what we can do is again, have it moving really quickly. And so for us as an organization, we have to remember that sometimes we just need to slow down. It's more important to do it right than to do it quickly, and we have time to do this work. And if you can move on to the next slide, and Caroline, I believe this is yours.
Yeah, so in this bridge year, you all have seen these goals and objectives. And, you know, staff, we took the new mission statement that you all adopted in October 2020, and we looked at ways to leverage and build on the Medicaid transformation work. And we arrived at these objectives. So throughout the year, we're gonna make day-to-day decisions and take actions to meet these objectives. And those are like the really practical implications of the work that we're gonna test ideas this year. And actually, one of the things that's really cool is because we're seeing the writing on the wall with distributed leadership, we're already testing ways to work with our community partners and create kind of processes that invite people in to identifying solutions. So let me give you a concrete example of that. The behavioral health work group that Wendy is convening is a perfect example of like a participatory process where she's invited anyone and everyone who cares about the behavioral health system in Central Washington. And they're coming together to make sense of the gaps and to figure out how to prioritize solutions. So it's really community driven, and I'm so excited to hear how that process goes. Wendy's worked really hard on building like a space where people are going to be able to shape the decisions, shape the priorities, shape the investments, which is really great. And I think to a certain extent we did that with work groups in the past, but not like this. So how we do things is already starting to shift in this bridge year this year. Also, I would say that as I've been partnering with the Coalitions for Health Improvement, and specifically the CHI leads, it's been really fun to explore how we can use this bridge year in 2022 to let CHIs make decisions, let them decide what their priorities are, and then give them total discretion to make investments. So that's kind of like that seeding control and distributing the decisions across our network. So we're already kind of testing this, and we'll look forward to bringing things back to the board this year as we learn about what works, what doesn't, what's difficult, and hopefully that can help shape how we think of our model going forward, both our decision-making model and our investment model and our engagement model. So I'll leave it at that for our 2022 goals. And I think, John, you have the next slide.
Yeah, and so as we're really building out that future state and we are getting our 2022 goals under speed and going as well, one of the things, again, and I think Ken referenced this a little bit as well, is looking at our governing board and how we govern as an organization as well. So I'll just bring you guys back to 6 months ago. For those board members who were here, we actually had a presentation from Mike Bonetto from Tenfold Health. And Mike's helped us, he helped us when we were going through the acting executive director work. And he's also helped us a little bit as internally as we've looked at how we shape governance models for the organization. And so he spent some time talking about different governance models for a board. One that's operationally focused to all the way other level to one that was focused on really policy governance as a whole. And so really, as we've been shifting and we've been building out our 3 pillars, we've, without really knowing it, been having a lot of shifting and changes in how we operate as a governing board as well. And so really in the early days of the Medicaid transformation project, we were a pretty operational board. The board was the only individuals doing this work at the start of the ACH. And so you were both the board and somewhat the staff. I think Kathy turned out, nope, Kathy has her camera on here. I think Kathy was actually supporting at the staff level at one point in the early days, if I'm correct, right, Kathy? You're shaking.
Yes, that is correct.
Yeah, you may have been our first ACH type staff person before Linda and I, if I was to be honest. I can't take that credit. And so the board really started there, and then as we've gotten our feet under ourselves, we've slowly shifted to a policy board without really, defining ourselves as a policy board. And to be honest, we're not really a strict policy board as well. We're somewhere between operations and policy in the way we function. And then as we've been exploring distributed leadership and distributed decision-making and governance, that also is influencing, how we look as a board and look really the tried true roles and the function of it. So again, we're really moving away from a board that's been focused on operations to a board that's really focused on providing leadership and guidance to our community on our mission, on our 3 pillars, and how we as a community are going to live and achieve that together. Because again, we're also moving away from NCACH, being seen as the group that's doing the work, to us as a community coming together for a regional portfolio. And our role is just to help steward that process. So the board as well is shifting in that notion. And even Ken earlier, when we were having nominating committee conversations, recognize that as well as, more community members are interested in joining our boards. We have to look at how we continue to engage community members and get broader input in the work that we're doing. And also, even for those who are interested, there are multiple ways to engage in this work and contribute to the decision-making process. That doesn't always mean they have to have a seat on the board. And being a steward sometimes means that some of the key decisions that people may be interested in may not occur at the board level anymore at this point. So there are other ways we'll want to include them in the work. So that's a conversation and things as we're building out, really making the pillars actionable that this year. One thing I also want to be sure when we land at the end of this year is what kind of governance are we functioning under, and how does that influence the makeup of the board, and how decisions and how work is getting done at the board. And we'll see that evolve over the course of the year. Again, I'll say that's not something we're deciding next month, but something that we'll take the time to have thoughtful conversation on. And then we'll move to the next slide. And I think Caroline.
Yeah. The perfect segue, John. Because if you're wondering what to expect during this bridge year, here's some things that we thought we would share. So by the July retreat, we're really hoping to spend the next 4 months really deepening partner relationships, having you join the partner convenings, expanding understanding of regional context, again, through partner convenings and also board learning that we're going to bring back at future meetings. And then having some initial ideas for end statements. And Monty is going to help us in a little bit understand what we mean by these end statements. So what we have time through July to kind of make sense of what those might look like. But by the end of this year, as John alluded, we would have a clearer sense of not just the end statements, but also the board's role. So we've been talking about maybe a difference between being stewards and how the board was functioning before. Well, by the end of this year, instead of you sitting here thinking like, that's vague, that's confusing, I'm not sure I really get it. By the end of this year, hopefully all of you get like, I now understand what it means to be a steward, and I understand what that means in terms of the shift in how our board operates. And then along with that, we would also have a plan for recruiting additional board members. So there's nothing that's getting like turned upside down. It's not like the game board is getting flipped up this year. We're just taking the time to think about it and be deliberate and understand what the shift means, and then planning for that going into 2023. Monty, I think you have a little bit more context about what these end statements might look like. Can you help us make sense of that?
You bet. Well, I'll do my best. So it sounds like some of you were there for the tenfold health conversation. And in one sense, this is like at a upper level, really simple and straightforward. I mean, the benefits of moving to this type of policy governance model is to avoid the two challenges that all boards tend to have, is either micromanaging things that they don't have time to micromanage very well, or rubber stamping things at the cost of not being, fulfilling their legal and moral obligation as good stewards to a really important organization like this ACH. So this model, which I've been trained on, has been a long time. I'm not a purist of any models. I'm not sure how Mike presented it all. He's really sharp. But I think that the thing I really like about this model is that it helps boards to fulfill its responsibility, its fiduciary and other responsibilities for keeping the organization solvent and doing what it's been contracted to do without spending all this time doing that. So it has some really specific mechanisms for doing that, and they're more on the executive limitations policies. And then on the other side of this, as some of you may recall, Mike probably shared this with you, is saying that most of the board energy should be going to, again, I'm going to, because John's thrown this out a couple times, as stewards, to best understand who they're owning this organization, this asset, this benefit from, on the case of a much larger group of stakeholders, and to really understand through them and with one voice as a board, what are really our desired results? You know, what does success look like? You know, and what detail do we want, how specific do we want to say that that looks before we hand it over to the staff to execute, to do what the staff needs to do. So I often will say what results for whom at what relative priority or cost, which is similar to what Mike has on this particular slide. And it is really a big shift because it means less time, kind of more internal focused, and more time theoretically. You know, lots of boards that I've worked with this type of model are spending more like 60-70% of its time looking externally to really understand how to weigh in on these questions. This is not like a one and done, we've created end statements. It's constantly saying, are these the right ends? How do we know we're making progress around those things? So just a little bit of context to let you know where I'm coming from as I kind of share. I think there's 2 more slides. I think when you have an organization, a lot of community health centers, for example, way back when, we're using a policy governance model, and because it's pretty clear what, you know, CHCs do, this is an example of what are the results, really improving access to care, and the board kind of saying, you know, this is what we mean by improving access to care for whom, really defining that based on, you know, income, and not to exceed a certain amount of resources that that particular community health center had. And so, not to get lost in the weeds, this is just an example of an end statement for a pretty discrete, well-defined service delivery organization. And that works well. And as you all know, because you've been creating this all along, or moving to this transition, as Caroline suggests already with the pillars, already paving the way for some of the things that John described, as a distributed network with a much broader set of aspirations and outcomes. That, you know, there's going to be different types of end statements. It's both an interesting new opportunity. And so this next slide, I just put a version. We're doing work with the North Sound ACH. And again, don't worry about getting lost in the words, but it's just an example of, like you all, they no longer have just the Medicaid transformation, what CMS says they need to be doing, that they've been contracted out to do and need to fulfill that obligation. They are now moving out of paint by numbers into what is that canvas, just like you all are, around what do we say we really stand for, and how are we going to best utilize our resources that we have now, and hopefully grow more resources beyond just those that are coming through the state and the CMS through this waiver year. So in their case, this is just an example of their purpose, but this first ends that this is just kind of a sample. They're really tasked, Liz and her team was saying, we want to make sure we're meeting the urgent needs and reducing barriers to well-being for individuals who are struggling the most. I won't read all those words, to really dismantle some of these systems and the barriers. This is the language that their group feels comfortable. And I would really stress that. I work with a lot of groups. I'm working with a group like now in Wisconsin that this language would not feel comfortable to them, even though they would very much agree with the spirit of this. And so whatever the end statements that you all come up with need to be reflective of your broader population. But nonetheless, this really is indicating that they're hoping that Liz and team will really be indicating that they're using resources to identify those that are most struggling with inequities because of barriers to access to health services, but other vital conditions. And then they have another end statement that is really around how they want to prioritize doing that within a distributed network, you know, and not just any network. They go on to define that a network that has a common narrative, a common vision, a common framework for how they work together. And so they're expecting that whatever Liz comes back with over the next couple of years, that will be reflected, that she's going to show evidence that that network is starting to use common language, common networks, common narrative by which they're kind of thinking about equity and well-being, and that there is increasingly regional investments that are well coordinated. So it will be incumbent upon Liz to say, yeah, here's regional investments, and look at this coordination between some of the local foundations as well as some of the other state resources, or maybe even some rescue to renewal resources through ARPA that are better coordinated because we exist. So this is just an example of how ends in this new world might play out for you all, and the types of things that John and team would be coming back to say, hey, we're honoring kind of what you all said right now in a version of your pillars, maybe kind of reworked and with maybe some more specificity that will be up to you before you hand it over to staff to say, we would like you all to figure out how to best execute this. So I know I just shared a lot with you, but hopefully the principles of, how putting at the ends in a world where you all are actually in relationship to a much broader set of stakeholders are kind of defining what those priorities are based on results. I'm looking at a number of folks that I'm just getting to know, and hopefully some of what I'm sharing makes a little bit of sense, at least the spirit of that, or others that may have a policy governance approach, if there's questions or ideas on that front. Or if those of you who are with Mike, does that seem consistent with what he shared?
One of the things that I think about going into this bridge year is the projects and things that we've done in the past as NCACH. I wondered who the players were. I wondered how did they come up with this project and all of that work that went into it. And now I think that this going forward is going to bring that all to the forefront and be transparent, and we will all be able to see the players and the movers and shakers that are going to be moving the needle in healthcare. And so that's what I wanted to just point out that I was interested and excited about that piece.
Thanks for that, Molly. I was with the North Sound ACH on Friday. They had a board meeting, and like you all, they're trying to figure out what does the board role in this new space look like in a distributed network. What is it that is uniquely the board's, and when the board member shows up in some other partner convenings or work groups, without just their board hat on, how do we meld those kind of different ways that we're working and learning together, much in the way that you all are starting to kind of expand the strategy work group from not just being a board function or an important appendage of the board, but something that is connective tissue across different stakeholder groups. And so I don't know if this is helpful, but I find it really interesting. So they have a resilience fund that's been built up over this last period, where they have the discretion around how to use that with the North Sound ACH. And John, I know you've talked with Liz a little bit about this. So the question had come up with the board on Friday around what's the board's role in deciding how to use these funds when we say that we want, the use of these X millions of dollars that we have control over now, but we really want community voice and we want community priority in that. And yet the board has really financial responsibility. So this type of model of a governance model and kind of a distributed leadership model, they decided that their role as a board was to really make sure that they were maximizing the return on investment, that they were being good stewards of that they were making sure they weren't violating any of the restrictions that had been placed on it from the funder, but that they were going to engage in a process with some guardrails around how to make sure that community voice and partners actually decided how to really maximize that money. And they would like to be part of that process, but they knew that the board didn't have the final say in that. They just had to say in where the parameters are around making sure that money was managed well. So I think that those types of scenarios, it might be ones that you all will continue to both wrestle with, and they felt really good about the decision that they made and are really excited about more people having influence on how those resources are going in their particular region.
I think it's going to bring out more communication between all parties, and that will bring about storytelling, which is what I love about this kind of work. The stories are compelling and heartwarming and exciting sometimes. So that piece, getting it out to the whole community, not just our small group where we know we do wonderful work, but to get it out to everyone and elevate it. It's just, I think, a good purpose for this board. So,
yeah. So, John and Caroline, again, I'm watching the chat. I don't know if we're still wanted to move into thinking about thriving or a little bit of some content.
Sure, do you want me to start sharing those slides?
Yeah.
You know, can I ask quickly? I'm gonna pick on those who were in the governance committee. It seems a long time ago, but I know it's not, and I see Ramona has a little smirk on her face. I know that we're all generally used to end statements that are more operational focused, especially when you're a service delivery provider. How did some of the ones you see on the screen, how did they resonate with you guys? Or what are things that excite you about them, or what are things that make you nervous when you see a statement like that?
Yeah, this is Mike. I think, those end statements are helpful to really show where the agreements are as far as how we're going to collaborate, and having that kind of clarity about what the outcome is, is I think really key, because, we're now in this, we've shifted a lot of medicine to outcome assessment as opposed to just doing procedures or doing, delivering care, but actually looking at outcomes, and that's part of the value equation. So as we look at high value care, we really want to know what our targets are. So it really helps to have clarity on those statements.
Other thoughts or comments?
I would agree. I took just a screenshot of those statements to get a better idea and be thinking about how to verbalize or put into words our ends. So I'm looking forward to that. Though I don't know that I would use the word dismantle in an end statement, but to each his own.
Mm.
And Kat's asking to put them on the screen for a moment. And Caroline, I think you can do that, right? And I may note, Kat, while you're looking at that, I had a chance to present to the Our Valley Our Future board on Friday about what we're doing as an ACH. And even like when you look at some of these end statements created, sometimes it's really hard to explain the outcome of what we do as an organization. So having some of these defined always helps, all of us center on some of the true tangible components of the work that we do. Because a lot of people are used to seeing, I took care of X number of patients, I made X number of visits, and I reduced their, diabetes control to closer to normal. And so a lot of these kinds of end statements are harder to sometimes grasp, because they move a little bit more to the intangible feelings versus like the direct outcome of the patient.
Mm-hmm. Just as a reminder, Liz took her first crack in December. So John, you and team so what do you mean by that your investments, you're thinking about current and future generations? Are you looking at investments that could have impacts, beyond this next quarter, that could really change systems that could be felt by generations? So there's an iterative process by which either the board would say, we want to make sure that you actually are investing in things that have some either evidence base or promise that they are not just kind of short-term investments. And so these words are still pretty high level, but as you go back and forth to say, as the executive reports, like how well are we doing on those? We start to get in very much more operational definitions. What type of measures are you using to actually frame well-being? So just on the other side of this is a much more specific results-oriented conversation to Mike's, sentiment as well.
I think it's always helpful to have a buy-win to just, it can be out in the future, but it gives you a goal to reach for. So it's just not something that stays on the end statement for years when it really needs to be done.
Yeah. Thank you. And just for the North Sound's sake, I just cut and paste these. This is not all their end statements. They have some much more.
I know.
Ones that are a little bit.
I was teasing. Wasn't very nice.
No, but I think your point is no, for sure, well taken. And I don't put these up as an example of that they've done it all right. I just wanted to give you a flavor of one that's probably closer to what you all are doing.
Well, it's good. There are times when there are really urgent needs, and there are times when things need to be dismantled. I think maybe calling it out is a brave thing to do.
Kat, go ahead. I see your hand up.
Sure. I just was going to say, I think this is where, from the space of sort of measurement, one of the things that we've been pushing ourselves to do is in that space of where stories matter, and really the qualitative information is important to help perhaps fill gaps where qualitative information is not, or quantitative information, excuse me, is not able to be had. And so I think it's just where in setting some of those end statements, how can we consider where are there opportunities where stories and qualitative information and data that we can ensure that we're valuing that in addition to more quantitative data, which I think we tend to lean towards as well.
Monty, do you want to share some of the Thriving Together framework? Because I think it provides a really interesting way to think about quantitative measures of these really big macro concepts of like, what does it mean to thrive? How do we measure that?
Yeah. Sure, I'm happy to jump in. And you can notice that North Sound, like a lot of other groups, are looking at thriving not just as a intuitive, positive way of thinking about their aims, but it's really measurable. I don't think this slide deck goes into deep measurement, but I can allude to that, and this maybe just give you a flavor around some of the Thriving Together work. And I can again offer this up as if there's deeper interests of kind of thinking about how it might adopt this. So Thriving Together, as some of you may know, yeah, thank you. That's good. You can start there. A few of us got phone calls actually from the federal government in the early stages of COVID to ask us to think about how we could engage kind of leading non-governmental organizations and community-based organizations around the country to see how they might be seen and responding to the compounding crisis that we're facing our communities in our country. That later we started to call that the springboard. And I'll share a little more of that. And on a parallel track, there's been the federal government, the federal plan that for long-term recovery and resilience.
Sorry, Monty, I'm pressing the wrong buttons.
That's okay.
Wait,
That's
and
okay.
tell me which
That's
slide
fine.
I should be on
That's
and then
good.
say next slide.
That's
'cause
good.
otherwise-
Okay, perfect. But it's probably worth noting so that the federal long-term recovery and resilience group that basically is looking at not just the immediate response to what communities are facing on a number of different fronts right now, but what are the long-term plans and investments? And this is now 30 interagencies from HRSA and HUD and SAMHSA, CMS, all are looking at how they build this, and they built the foundation framework based on this Thriving Together piece. That is a bridging framework for them, and it will impact measurement and investments and policies and how the federal government will relate to states and communities. So in that sense, we weren't sure exactly if it would get used or not, but it is being used as a driving document and process for that. So on this next slide, for those of you who may or may not know, that thriving is a very strong social science indicator that's been measured for a couple of decades, and Gallup has been measured around the world. So it's one that is sensitive and cuts across cultures. And So looking at thriving in relationship to who's thriving, who's suffering, who's struggling. And that's based on Cantrell's ladder question, which is really, where would you place yourself on best possible life on a scale of 0 to 10? And where would you place now? And where would you place it 5 years from now? So that simple self-report reflection is a very, very powerful indicator on a bunch of fronts. So we have looked at using thriving, that kind of sense of how we feel, think and function, as one measure, not the only. To Kat's point, I mean, there's and John's, there's qualitative and quantitative, but we use that as kind of our driving force for kind of asking this question of how might we respond, given the current service situation in our country and our communities, to bring us not just to the status quo, to build resilience, to bring up thriving. And it became kind of all people in all places thriving, no exception, which is on the next slide. Kind of where we started. And that was, with an inquiry, how can we convert loss into renewal? And we started with the premise of how do we really think about the immense reservoir of resilience that's embedded, that's either being activated or could be activated in our communities to really help us organize around local and nationwide action around this unifying measurable expectation. As you can see, all people in all places thriving, no exception. Next slide, please. And this is, I'd forgotten this slide was in there, but this is just kind of a little bit of a tip off to measurement for later on. So well-being, you can be seen, and it can also be measured by those personal, and that's like the Cantrell's ladders. There's some other measures that we use, a number of open source well-being surveys. And well-being, as many of you know, is a construct that's growing in popularity. It's, I think our team for the last 20 years, always, if we talk about health, we always say health and well-being, because no matter what, health is almost always narrowly defined in our own minds, even though the World Health Organization for 30 years has talked about this broad notion of health. Well-being tends to kind of broaden that out. And so well-being really looks at our mental, physical, social, spiritual, financial well-being, all the dimensions. And as you all are talking about whole people, whole care, whole community well-being, it could be a really nice way of thinking about that, not just in languaging and stories, but also in the ways that we're measuring well-being. And so the other way, I'll just quickly, sorry about that. There are these urgent services. So one way that we're looking at well-being in the country, and when I say we, it's a little bit of a royal we, but folks that are the leading measurement folks, one of our partners, I know you met Jane Erickson, but the Rethink Health, Bobby Milstein, who is a leading expert on kind of well-being, was in charge of syndemics and social determinants of health at the CDC for a long time. Now he's the Ripple Foundation. Rethink is he and a lot of other folks, National Academy of Medicine, have been really thinking about the vital conditions of well-being. And so we're looking at the combination of what are the urgent services and vital conditions as part of our environment. And I realize I'm speaking pretty fast because I think we can follow up with some material, but just know that there's some really interesting innovations in measurement right now around how we can measure these pieces. And so since I've touched on the vital conditions, I think this next slide was there another one before that? Or was it after that? No, okay, that's okay, if you can go back up. So these are the 7 vital conditions that have a lot of overlap with the social determinants of health. And social determinants of health is good. There's nothing wrong with it. We find this, and again, the folks that created this were folks that have been leading a lot of the social determinants of health work, is a little bit easier way for talking about and framed in a way that is easier for communities and other partners that aren't part of health and human services and public health in some ways. We tend to look at these with both lenses, but these vital conditions are things that all people, no matter where they are in their life course, no matter where they in the globe, need on a regular basis to thrive. So, and underneath these are a lot more detail and metrics and those types of things, but just as a quick glance, thriving natural world, as we know, and I know that there's been some challenges all over the country and up in your neck of the woods too, just around not just sustainable resources, but actually kind of freedom from harm from natural disasters. So there's the thriving natural environment that obviously plays a key role. There's the basic needs for health and safety, and in that includes things like, routine physical and mental health, food, freedom from harm, addiction, trauma, and kind of basic public health infrastructure, all kind of that's what this one is composed of. And then humane housing, again, that is really straightforward. The type of housing that is affordable, reliable, safe in all different ways. Meaningful work and wealth really gets at not only having family sustaining wages, but a sense of dignity and purpose in our work. Lifelong learning includes the first 1,000 days of life, but also talks about the emotional support, trauma free, the trauma informed approaches and to K through 12 and the emotional well-being in K through 12, as well as lifelong learning, whether one pursues or has an opportunity to go to college or other paths, seeing that. So there's a number of strategies and indicators around that vital condition. Reliable transportation, same thing, the type of transportation that we can count on, that we actually have access to the things that we need or desire. And then this last one I'll double click on because it really animates all the others. It's a vital condition, but also plays a really special role, which is our belonging. And all of the work and research that we know has been going on, but particularly in the last few years, about how important belonging is to our well-being. And some of you had access, were exposed to some of the work of John Powell, this notion that belonging is a co-creation process, and that it also is our civic muscle, our ability of our communities, your chais, the regions, to be able to actually affect their destiny in some ways. So this is a vital condition that influences our well-being. And so as this kind of visual graphic shares with you, thriving, suffering, and struggling is really one way that we start. And the question is, what are those wraparound vital conditions that allow us to boost thriving and reduce suffering and struggling? And there's a lot going on in this slide, but just to state the obvious, when we are impacted by adversity, like an economic downturn or a crisis that is precipitated by a natural disaster or a global pandemic, we have demand for urgent services. And so that's why this, how do we make sure that we're attending to that and doing that with care, to quote Wade, to do it with actually even love, systems and relationships, but to not build an adversity economy, to not build, how do we start to move people back to the vital condition? So that's a lot of what Thriving Together is about, that many partners are working on. And I won't go into these kind of renewal areas, just to know that our thinking, there's a lot of work around these three areas of our common life, which is our civic life, whose voice, a healthy democracy, our economic life, economies that work for everyone. What does that look like? And what does our social, emotional, spiritual lives look like? So those are all pieces that we think are really pathways to kind of thriving together. So that's a lot in a nutshell, but maybe it whets your appetite for, this is not just here's a list of social determinants or another framework like county health rankings and roadmaps, which is great in partners, but there is a larger narrative, if you will, and only even a theory of change. And one thing I didn't point out is legacies. So these legacies are the things that we've inherited since the beginning of our country. And we know that some of those legacies are about dignity and inclusion and innovation and all the goodness that has come through, many things that we've done together, advancements in human and civil rights. There's legacies at any within the North Central for sure. And we have legacies of exclusion and harm that date back to the inception of our country. And the idea is, how do we make sure that we are thinking about the legacies that we've inherited from our ancestors as we're thinking about strategies and recognizing that we can create new legacies?
And Monty, we're at time. I know there were a few more slides, but I think, like you said, we're going to come back to this model, and it's something we're going to share with our partners as well at the partner convening. So you'll hear more about it. And I don't know if there's any last minute stuff, Monty or John, that you want to kind of wrap this session up with before we head into the telehealth fund.
Yeah.
I can see comments that people like this framework, it resonates. And I think one board member, it might have been Jesus, that a prior board member mentioned that it would be helpful to have a framework to come around. Like the pillars are one thing. The pillars kind of talk about how we're going to work together to figure out priorities and make investments. But what's the thing that we can have, the shared language we can have in a framework where we all can make sense of things? Like, what does health and well-being mean? Where do we want to prioritize? So this is one potential framework to use, and there'll be more to come, right?
Yeah, and thank you. I apologize for not totally paying attention to time and where the hard stops. So I think that's right. We can pick this up. And the nice thing about the Thriving Together is the federal government is a lot of their work. I was going to say the Social Impact Exchange, a lot of social impact investors, including large foundations, see this as not the only framework, but they see it as a bridging framework. And we have some leading metrics around this that we can kind of share, and they can live side by side with more traditional social determinant metrics or with disease burden metrics. And so we can kind of show you that. The nice thing is that there is a stewardship piece around this that I think is very, what are the practices of stewardship in a distributed leadership network that you all could figure out how to make your own as you're moving into this space. So would be delighted if there's parts of this that you find useful, and happy to share more. But grateful for a little bit of time with you all today. And congratulations on kind of starting this new year and all the work that you've done to date to get it here.
And I see, Ramona, you put in the chat that this resonates with you. And I think for a lot of people, when you look at these vital conditions, especially those who have been trying to do improvement work in clinical settings, these are a lot of the things that are really the crux of what's keeping individuals from being healthy and really thriving. So again, these are the things we need to come together as a community to help driving. Certainly, like you say, is a framework of how we start moving that direction and how we start adding some focus. And we may tweak it a little bit here and there, but it gives us a sense of how to start engaging those discussions.
I promise will be the last thing I say, but I just wanted to point out that the Institute for Healthcare Improvement, that many of you know, are partners on this vital condition. They contribute to this, the Wellbeing Trust, a lot of the leaders in mental and behavioral health, and they are adapting this into their pieces. And I'll send some of that. That might kind of, as you're making the Medicaid transformation.
And then Molly, I think we can wrap it up there. Send it over to you to move on to the next one.
Yes, and I do. And I just want to say that I love the word thriving and that piece. It just so much better than social determinants of health. It's so much more. So I'm excited about the next trainings. But now we have Wendy with our telehealth. So Wendy, go ahead. Thank you.
Great.